Hello, everyone, and welcome. My name is Tom Etges. I'm a family physician with Helms Medical Institute. I'm a family doc here in Eugene, Oregon, and one of the faculty preceptors with HMI. We have an upcoming auricular acupuncture course coming up in July. It's actually Sunday, July 19th, that I hope you will join us for. And there have been some notes going out about this upcoming course, but I thought I'd introduce you to some of the concepts that we'll be going over. Many of you may have heard about auricular acupuncture. This is basically a form of treating a patient with points located on the ear, both the front and the back. This has become a much more available way of treating patients without medications. It can be done in a very timely fashion. It's very low cost, and it can be easily integrated into a busy outpatient practice. And even those that are working in hospital practices, including emergency room, have found this to be a very beneficial integrated part of their treatment. Helms Medical Institute has been using auricular acupuncture as part of their training protocol for many years. We wanted to introduce a method that those who have never trained in acupuncture can easily learn in this course that lasts a full day. But by the time you're done with this course, you will be ready to treat the very next day. You'll be able to treat patients very effectively, and you'll be amazed at the results. Briefly, auricular acupuncture has been around for, some say, thousands of years. Originally, a technique in folk medicine around the Mediterranean, but in the 1950s gained a lot of interest, and since research has really delved into the methodology, later in the 1990s, early 2000s, with the introduction of functional MRI and additional studies, we've really been able to understand from a scientific literature-based point of view, very evidence-based. So this is something that you can come away with this course with a good understanding, with a hands-on method to treat your patients. What do we use it for? Pretty much everything in family medicine I can think about, but it's had a lot of studies in areas in mental health, including post-traumatic stress, areas in pain management, definitely a go-to in chronic and acute pain problems, insomnia, which is a difficult thing for any of us to treat, and addiction. So there are many applications that going into it, you're going to find very useful. It's easily accessible. Most people have an ear you can easily reach. You can do it in an office setting, seated. You don't need a table. Doesn't take very much time to put these points in. Some patients will wear these home. I just find it to be one of those tools that I wish I would have learned back in medical school over 38 years ago, but here we are. So I encourage you to consider signing up for this program. Help spread the word, and if there's other colleagues of yours that might be interested in adding an integrative tool to their toolkit to help their patients, please help spread the word. And hopefully we will get to see you and work with you all together on July 19th, Sunday. And go to the HMI website if you need more information about how to sign up. And I hope to see you all there. Great. Thank you. Bye-bye.